Welcome to Mohan's Bones and Joints Clinic. Hello. In this video, our senior consultant orthopedic surgeon Dr. Mohan Krishna will guide you through the essential steps to prepare for total knee replacement surgery, especially if your knees are completely worn out. Your journey begins with a visit to the hospital. First, you'll complete the registration process. After that, I will conduct a thorough examination of your knee, which includes obtaining standing X-rays to assess the condition of your knee joints. If the X-rays show that your knee is completely worn out and classified as stage 4, we'll discuss the option of total knee replacement surgery, often necessary when other treatments have failed to relieve your pain or improve mobility. Once we confirm that surgery is the right choice, we'll focus on your pre-surgery preparation. I will prescribe supplements like multivitamins, iron, calcium, and vitamin C to enhance your overall health. You may also receive injections of bisphosphonates and vitamin D to strengthen your bones, ensuring your body is in optimal condition before surgery. We'll perform a comprehensive medical evaluation, including blood and urine tests. A cardiologist will evaluate your cardiovascular health, and if you have diabetes, we'll collaborate with a physician for effective management. After all evaluations, we'll arrange for an anesthetic checkup. This is crucial to ensure you're suitable for anesthesia during the surgery. Once everything is finalized, we'll schedule your surgery date. If you have health insurance, we'll seek approval. Otherwise, we will discuss costs based on your room choice. On the day of your surgery, you'll be admitted directly to the operating theatre. Remember to fast for at least 6 hours beforehand and follow any medication instructions. An IV line will be inserted, and you'll receive spinal anesthesia from the anesthesiologist to keep you comfortable during the procedure. During the surgery, my team and I will prepare your leg and perform the knee replacement. Afterward, you'll receive a femoral block injection for pain management. You'll be monitored in the recovery room for about 3 hours before being moved to your hospital room. About 4 hours after surgery, you can start with liquids and gradually move to solid foods. You'll receive IV antibiotics and pain relief medications. On the first day, our physiotherapist will help you sit up, stand with a walker, and take a few steps. This initial rehabilitation is vital for your recovery. Discharge is usually planned for the second post-operative day. You'll receive detailed instructions regarding your exercises and ongoing care, including prescriptions for antibiotics and pain relief. Your first follow-up will be 4 days after surgery for dressing changes, with another appointment 2 weeks later for suture removal. If you have any questions or concerns during this process, please reach out to our office. We're here to support you every step of the way. Thank you for choosing Mohan's Bones and Joints Clinic. We look forward to helping you regain your mobility and enhance your quality of life through your knee replacement journey.